Hi, my name's Ilan Lieberman. I'm one of the co-founders of the Elyfia app, and I want to take this time to talk to you today about what to expect from a new patient consultation at a pain clinic. So you've been referred to the pain clinic, and you've probably spent quite some time waiting for your appointment. It's a big day for you. But the first thing to remember when you've been referred to a pain clinic is that your doctor hasn't given up on you. What he wants is some more specialized input into managing your pain. It is your opportunity to be the star of the moment, but being the star takes preparation. And in this little talk, I'm going to talk to you about how you can prepare for that and what the doctors and clinicians and nurses and psychologists really want from you so that they can offer you the best part of the service. Okay, so the first thing to remember is that unexpectedly, what people don't really want is you to blurt out where your pain is immediately. An assessment in a pain clinic is what we call a biopsychosocial assessment. It takes a look at the whole person. And so the information you need to give out to your doctors is your whole person. And when they start asking you whole person questions, don't get offended that they're not instantly interested in your pain. They're interested in how the pain impacts on your life. So that will be everything from how far you can walk, who does the dishes, who puts the bed clothes back on, who helps you wash and dress, who helps you with your socks, how far you can run if you can run, who does the shopping, what your sleep's like, what your relationship with your spouse might be like. It's quite intrusive. Don't be afraid of that. It's how we understand how the pain impacts in the whole person. Okay, so who are you going to meet? That really depends upon the type of service you're being introduced to. So some services, you may meet a psychologist, a pain nurse, a pain doctor, and a physiotherapist all on the same day. Don't be intimidated by that. Welcome that, because that means you're really into a very, very well-financed, well-organized, and thorough service. Some places, unfortunately, don't have the resources for that. So you may only meet a single practitioner, a chronic pain nurse, a chronic pain physiotherapist, or a chronic pain doctor. Don't be disappointed that that's the case, because in other services, they coordinate behind the scenes. You just see the little duck on the surface, and beneath the water, you see the legs moving very quickly. But as a service user, you don't necessarily see all of that. So you're going to meet and be treated by a variety of different people in a service, which is why the variety of information that you have to offer can become quite complex. The other thing is, please don't get irritated by being asked the same question again and again. People's expectation of what a medical record is nowadays and what a medical record is actually like nowadays are very different. The information sharing can be problematic. We may not necessarily be able to see the MRI scans done at other hospitals, or the letters from other hospitals, or the investigations by other specialties. Bear with us. We get as frustrated as you do, but we have to stitch everything back together in the background so that we can offer you the best assessment of the whole of you. So what actually happens? Well, you're going to turn up at a hospital. You're going to have some trouble parking. It may be a bit of a wait, so be prepared for all of that. Take some reading material, take something to keep you occupied, and don't do your time slot for the clinic appointment, which has very short periods of time to do other things before and afterwards. Expected it to be a bit delayed, like an EasyJet flight where there's an air traffic control strike. It may be a few hours rather than the exact hour time slot. Bear with the system. It's doing its best. You will then be seen and assessed. There may be a whole bunch of forms that you've had to complete beforehand, and you will then be interviewed by someone, and they'll talk about everything. At the end of the interview and the examination, the doctors and nurses and psychologists may go off and talk to each other, or they may talk afterwards and then send you a formalized letter. It depends upon each service and how it's structured. Don't expect to be cured there and then. That's clearly for the birds. It's clearly not going to be possible from a pain service. If you had a persistent pain problem that was easy to manage, you wouldn't be at the pain clinic. Expect to have decent explanations of what's going on. Expect them to take quite a bit of time with you. A new patient pain consultation should take between 45 minutes and an hour. If you've been seen in 10 minutes, that's not good enough, in my opinion. They will take their time to go through things with you. You need to be able to offer your time for that. At the end of the consultation, I think the minimum that you should expect is an explanation of what's going on, a shared decision-making process where they explain things to you, listen to your reservations, listen to your concerns, listen to your questions, explain that again, go through the options, and then at the end of that consultation, if it's possible, have a a plan formulation to begin with that you can work to and that they can understand that you're going to be happy with. Now, what different services can offer does depend upon which region you're in and what resources they have. And that isn't in the control of the doctors and nurses and physios and psychologists treating you. That is beyond their control. So please don't get frustrated with them. But that's what you should expect. A consultation that takes some time, people listening to you, people being empathetic, people explaining to you what's going on, and then some sort of structured plan going forward. So how can you help them in this process? Well, it's actually quite useful to bring information with you. If you have letters digitally or on paper, print them out or bring them so that it's easy for people to understand. Bring an advocate with you if you find talking about your problem difficult or you find it difficult to explain, or if you have language difficulties, they should provide an interpreter, but that's not always possible. So bring someone to support you if you need to. Bring information that's really helpful. But also don't dive straight into your pain. Explain things to people. Doctors and the rest of the clinicians are not necessarily interested in every single pain you have, but more the bigger picture. So if you consider it as a view of a mountain, they're not necessarily interested in each particular rock, but they do want to know whether it's snowy or not. They do want to see the whole picture. So try and explain to them the periodicity and how it affects you in general, rather than focusing on specific things, unless you have a burning desire to focus in on something specific, which is your only problem or really where you want them to focus. You can also guide the consultation the way you want it to go to, as well as the clinicians guiding it in the way that they normally expect. So it's a two-way process. So after this investment that you've made, the car parking fees, the time investment, taking time off work, and the high hopes that you have, what's it reasonable to expect? So I think, in my opinion, what it's reasonable to expect is a decent letter summarizing your issues, a management plan within that letter that clearly explains to you where you're going to go, step 1, step 2, step 3, step 4, a discussion about medication reduction or augmentation or change, something that's clear and understandable, the next steps, like any other meeting, who you're going to see next, when you're going to see them, and what to expect from that. Some type of understanding if you've had an injection mentioned, proper consent around that and information around that. And while we're on the subject of these sorts of things, are you happy with that? And do you feel fully informed into the next step of a procedure? But equally, do you feel fully informed into the next step of a drug or a psychological intervention? It may be that they've put you forward for a pain management program. You need to understand how that's going to be run, what the time expectation of you is, what you need to say to your employer, how you're going to schedule that time off work, and the art of the possible around that, plus all the educational material and all the time investment and what to expect out of it. So really, it's about managing expectation, both from your side and from the clinic side, and for that information to be imparted to you in a clear and transparent and time logical fashion so that you can schedule your life. Because there is often quite a bit of demand in terms of what you are going to have to put into the therapy program itself. So I hope in this short video, I've framed what is a reasonable expectation from your first patient appointment at a clinic. I think it's worth now talking about how you journey through the clinic. You will have a series of appointments for therapies, for psychological interventions, for needle interventions, for medication reviews. In my service, like everyone else's NHS service, time is challenged. And sometimes the appointments don't occur at the right time. It's difficult to schedule in when you feedback about imaging, when you feedback about information. Bear with the service, they're doing their best for you. But equally, it's very reasonable to expect dates, times, and some sort of scheduling system. So articulate that, explain that, ask for it, and you're much more likely to get what you want if you engage and explain and ask for outcomes than if you just leave it and hope. So my name's Ilan Lieberman. I'm a consultant in pain medicine. Thank you for watching this video. If you'd like to see more of our videos, subscribe to the channel. That would be great. We've done the app. It's available from the App Store called Elyfia or through elyfia.com. It's a health coaching platform where you can message the platform around how you're getting on with your health, and a health coach, or a human being health coach, gets back to you asynchronously, meaning it's not immediate, but it's within a few hours or a day or so that we can help you in the long term manage your pain problems, manage your fibromyalgia, and get your lifestyle and your life enjoyment back to where you'd like it to be. Thank you very much.